It is a privilege to join you here today to not only share what we are benefiting, but also to thank the COVID Fund for the diligence and the hard work they've done in our response to the COVID. As we are all aware, the world is facing an unprecedented challenge with communities and economies everywhere affected by the growing COVID-19 pandemic. So far, about 12.4 million people have been affected, with about over 257,000 deaths so far. Ghana has so far recorded about 51,000 with 500 cases with 323 deaths. And as we speak today, our active case is 819, a decline in what we saw in the last 2 weeks. That is not to say we should be complacent, but to say that the responses and the activity that is being carried out with support of this fund has played a great role in our way we are able to respond on time. In response, the world is coming together to combat the COVID-19 pandemic, bringing governments, organizations across the industries and sector, and individuals to help respond to the global outbreak. We in Ghana have experienced a similar situation where there has been an outpouring of national solidarity and support from all sectors, and I must recognize that the support sparked by this shared challenge has been very, very phenomenal. These donations have supported our work as a service to track and understand the spread of the virus, to ensure patients get the care they need, as Dr. Ali has mentioned, frontline workers get essential supplies and information, and to accelerate research to further understand how the virus operates and identify the best treatment for all who need them. As part of our response action for the effective management of COVID-19 pandemic, there has been and continues to be distribution of large quantities of personal protective equipment and other equipment to the various health facilities and treatment centers within the 16 regions. These PPEs and other products from the central level to the regions are acquired through MOH and donations from some benevolent individuals organizations, as well as a large part from the COVID-19 Trust Fund. The COVID-19 Trust Fund has provided strategic support to the health facilities, isolation centers, laboratories, and COVID-19 centers engaged in the tracking, testing, and treatment and general management of COVID-19 cases. Ladies and gentlemen, this support, as has been mentioned, included provision of vehicles to our labs and our treatment centers, personal protection equipment, especially gloves and medical masks, goggles and face shields, and N99 respirators, medical equipment, consumables, example ventilators, as we mentioned this morning, the laboratory equipment, consumables, including amounting over 5.5 million cedis. That is just for that laboratory support alone. Since the start of the crisis, one of our goals has been to work around the world to get PPE distribution chain up and running across the country. We want to ensure that the appropriate and adequate numbers of PPEs to all health workers are available. The support and immense contribution from the National COVID-19 Trust Fund made it possible to supply these PPEs to all testing and treatment centers, as well as health facilities across the country. To date, Ghana Health Service, Ministry of Health, and other partners have already delivered hundreds of millions of items of frontline workers, and constantly ramping it further, thanks to the support also in part from the COVID Fund. Additionally, the provision of vehicles supported case investigations and contact tracing, which is a core disease control measure that we employ to a key strategy for preventing further spread of the virus. Through the provision of vehicles, the service was able to conduct enhanced contact tracing in the high-risk regions, immediately identify and isolate cases to prevent further spread. On the other hand, the provision of medical and laboratory equipment and consumables supported us to fully set up our treatment and isolation centers to manage positive cases. Whilst acknowledging the immense support the government, development partners, and other benevolent entities in ensuring availability of adequate PPEs and other equipment. The service still requires PPEs as these are necessary to fight in this pandemic, which continues to go on. The provision of PPEs to healthcare workers is a key component of infection prevention and control, ensuring that healthcare workers are protected means more effective treatment, containment of all. Without the proper PPE, as has been provided for us, healthcare workers are more likely to become ill. A decline in the supply of healthcare due to worker illness combines with intensified demand for care, causing healthcare infrastructure to become unstable and thus reducing the quality and quantity of care available. The support, therefore, from the COVID-19 Trust Fund has been timely and cannot be underestimated. The Ghana Health Service is deeply grateful to the Trust Fund who responded to our initial response and preparedness plan, thereby complementing the government's efforts in combating the COVID-19 pandemic. To all individuals and benevolent organizations who made donations to the fund, and to those whose contributions were in the other forms, we say thank you for the commitment and support. As we are well aware, there has been a surge in the numbers of COVID-19 cases around the globe, and we in Ghana are not completely out of the woods. As this outbreak evolves, funding needs are likely to increase, and we will therefore urge all to continue to join the movement to support us in the implementation of our revised strategic plan through your contribution to the Trust Fund. It is worth mentioning, Nana Chair, that COVID-19 Trust Fund have expressed keen interest in support the distribution of our COVID-19 related commodities to the regions. It gives us another reason to support and contribute the fund to ensure that this support to the regions is conveniently carried out. I believe that the pandemic aside, the harm and negative effects has also given us opportunity not just to fight one disease, but to change the trajectory of health service delivery in the country. The pandemic has also emphasized the key role of logistics as well as the importance of supporting and protecting people who play a critical role of saving lives. We all have an opportunity to build a healthier, safer, and more resilient health system for ourselves, our families, our community as a whole. Let us not as the virus to win the war. We are gradually moving towards further easing of restrictions. And as such, we have to intensify our preventive and protective strategies as well as promotive strategy to forestall the upsurge of cases. Opening of the schools in January is one activity, and also the logistic requirements of deploying vaccines is another Herculean task awaiting us. I want to use this to appeal for more donation to the fund so they can continue support response effort. As a service, as I conclude, we will continue to ensure the implementation of additional response plan in the area of case detection and isolation and treatment. We will ensure that there is clear guidance on the type and amounts of PPEs needed. We will facilitate the distribution across the country and also advocate to secure future supplies from both home and abroad. Once again, we are very, very grateful to the National COVID-19 Trust Fund and look forward to a stronger collaboration moving forward. And once again, we plead that let everybody bring their hands on board so that we can raise more funds to support the response. Thank you very much.